Hello, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to take some additional questions that you might have about dog cancer. And I've got an assistant that's going to ask me a few questions that you might have.
Is there a test to screen my dog for cancer?
So the answer used to be no. Not until about the last probably year or two have we been able to say yes now. We have some really nice new screening tests for cancer. So one of those tests that we're now offering our clients that have dogs and want to screen for cancer, one of them is called Canine. And we also do have another test that is also available for cancer screening called the IDEXX Nu.Q test. So yes, we can now start testing and, well, I guess screening your dog for cancer.
How often should they be screened, and when do you recommend to start screening?
So if you have a dog that is a known cancer, increased prevalence of cancer in the breed, for example, golden retrievers, Boston Terriers, boxers, mastiffs, Great Danes, we actually may recommend starting to screen those breeds at potentially a younger age. If you have a mixed breed dog and may not have had cancer in that dog prior, or you've not had cancer in another dog, generally a good rule of thumb is when they're around 7 years of age would be a good time to start screening that dog. And then once we do start screening your dog for cancer, we're going to probably recommend that we do that at least once a year, or if they come in and they're not feeling well and we're not able to find their source of their illness, then that might be a good reason to test them for cancer.
So what's the most common treatment for cancer in dogs?
So it depends on the type of cancer that your dog has on what we are going to recommend for treatment. For example, if it's a lump or a bump on the surface of the skin, depending on how large it is, we're often going to recommend surgical removal. If the tumor is really in a tough spot for us to get to, so maybe around the face, maybe on the distal extremity, some of those tumors can get quite large before they're dealt with, and so radiation can be used to help shrink those tumors and then maybe surgically remove them. If it's a tumor that's more internal in the body, for example, the spleen is a common organ to get hemangiosarcoma or other types of cancer, then we can simply remove that spleen and hopefully cure your dog of that mass. So surgical removal is always the best if we can, because we can debulk the tumors and potentially cure them that way. Beyond that, then some of the other treatments can include oral chemotherapies as well as IV injectable, usually chemos, that are used to treat dogs.
Can medications or diet be used to treat dog cancer?
Yeah, so medications can. In fact, there's so many different options on the market. Oftentimes they're borrowed from the human side and have been used now in the dog model. There's also some newer available medications or treatments that are being targeted toward the specific type of cancer and the genome of that specific cancer type. And there is a company that is making it a little bit easier for us to do that with, called Phytocure. And so we're actually able to partner with oncologists in Phytocure and find more targeted medications for your dog's cancer. What was the second question?
How frequently will my dog need treatments usually in these kind of situations?
Yeah, so treatment depends on the type of cancer. So there's usually cycles of cancer treatment. So cycles are every once a week, sometimes every 3 to 4 weeks. So it really depends on the type of cancer and what treatment they're on, and oftentimes there's cycles of treatment that occur, just like in people.
Is cancer treatment in dogs painful?
So not necessarily. I mean, surgery can induce pain, but that's where we're going to have good analgesia, and we're going to partner with you and maybe an anesthesiologist or a pain management specialist to provide pain management. If they're getting IV treatments, then obviously the discomfort may occur because they're having to get an IV catheter placed. But generally, the actual medications that are used or treatments aren't specifically known to be painful.
What are the biggest factors in having a successful treatment of dog cancer?
So partnering with your veterinarian and often partnering with an oncologist would also give your dog the best options of treatment in curing your dog. And the sooner we can find the cancer in your pet, the better we're going to be able to treat it. So if you have any more questions about canine or dog cancer, we encourage you to reach out to your veterinarian or call us here at Blue Oasis Pet Hospital.